The history of hospice service has developed for over 30 years. In this session, we are pleased to invite an important figure who participated in launching the hospice services, Miss Lucy Chung, to share with us about the situation during that period of time. Lucy was one of the nurses to establish hospice care in Hong Kong and is also the first person in Hong Kong to hold a master's degree in palliative care. Now, let us invite Lucy to review the history of hospice service in Hong Kong.
The history of hospice service development in Hong Kong begins in 1978. At that time, Sister Helen Kenny, the head nurse of Our Lady of Maryknoll Hospital, and Sister Angie's Ho Kwai Ping visited Canada to attend an international symposium on hospice services. I met Sister Anges Ho in the early 1980s. I was working in the hospital's rehabilitation ward. Although it was called a rehabilitation ward, most of the patients were actually terminal cancer patients transferred from major hospitals. Sister Anges Ho was the hospital chaplain for the ward at the time and came to visit the patients. She told me she had recently visited some hospice services abroad and saw that both the UK and the US had well-developed services to care for terminal cancer patients, improving their quality of life and significantly alleviating their discomfort. After hearing what Sister Anges Ho said, I applied to study hospice care nursing at St. Luke's Hospice in Sheffield, UK. I observed that the care for terminally ill patients was excellent. Even though many patients were at the end stage, they were comfortable, with their pain and symptoms were well controlled, and their quality of life was good. When I returned to Hong Kong after my studies, Our Lady of Maryknoll Hospital wanted to set up a hospice care team to care for patients in the hospital. So, I joined the hospital and, together with the medical team at the time, started a hospice care group. This was the first hospice service in Hong Kong. Because hospice service was still a brand new concept at the time, many media outlets, including newspapers and television stations, reported on this service. After that, many colleagues from hospitals also interested in the service. I remember a television show documented the condition of a hospice patient, which drew a lot of public attention to hospice care. This led to the first symposium on hospice service in Hong Kong in December 1984. We invited Dr. James Hanratty, the medical director of St. Joseph Hospice in the UK, as a guest speaker to introduce the concept of hospice service to healthcare professionals in Hong Kong, and over 200 professionals attended. In 1985, a few friends and I began meeting monthly to plan how to promote hospice service in Hong Kong. They were Sister Mary Gabriel, the medical superintendent of Rutanji Hospital, head nurse Sister Mary Greeny, the Reverend Lee Ting Sun, Father John Russelland, and Dr. Tam Waiyan. In 1986, we received funding from the Keswick Foundation to establish Society for the Promotion of Hospice Care. In the early days, we did a lot of educational work, such as organizing courses and lectures in hospitals, medical schools, and nursing schools, to help healthcare staffs understanding how to provide better care for terminally ill patients. We also visited different social service organizations to introduce the service. At that time, the demand for hospice services was increasing. Between 1986 and 1987, several hospitals, including Rutanji Hospital, Nam Long Hospital, Haven of Hope Hospital, and United Christian Hospital, started establishing hospice services. However, there was no community-based hospice care yet. In 1988, the SPHC launched Hong Kong's first home-based hospice care team, with nurses visiting patients' homes to provide care and support. In the same time, we also began planning for Hong Kong's first independent hospice. With the support from the Keswick Foundation and the Bradbury Foundation, and received a land grant from the government, Bradbury Hospice was built and opened in 1992. Before that, we provided specialized training in hospice care for all newly joined staff. Subsequently, the Bradbury Hospice also became an education center for training healthcare professionals in palliative care services.
With societal development, people are aware that hospice service is not only for terminally ill patients. Therefore, in 1990, the World Health Organization began using the concept of palliative care. When a patient suffers from a life-threatening and serious illness, they should not wait until the last few months to receive this care. It should be started earlier. In 1991, when the Hospital Authority began managing all subvented hospitals in Hong Kong, it established palliative care services in different hospitals. In the following years, palliative care gradually became a specialty. In 1995, the Hospital Authority launched a certificate course in palliative care nursing. In 1997, the Hong Kong Society of Palliative Medicine and the Hong Kong Palliative Nursing Association were established. In 1998, palliative medicine officially became a specialty under the Hong Kong College of Physicians, making it the first officially recognized palliative care specialty in Asia. In 2002, the specialty of palliative medicine was also established under the field of clinical oncology in radiology. Today, hospitals with a clinical oncology department have specialized teams providing palliative care services.